All right, in lesson 5, we're going to look at the labor market for physicians. Click on this link to answer these questions, and then click on this link to answer that question. And then click this link to answer these two. What I'm going to do is I'm going to go down to the beginning of the problem, let you handle those questions. In markets without government intervention, physicians are free to work for hospitals or establish private practices. Suppose all physicians in Western Caucasia supply their services in private practices they each own. Think country doctors. The Caucasian Medical Association, KMA, headed by the most respected doctors in Caucasia, hires a team of economists and data scientists to forecast the hourly demand and supply of healthcare services in Western Caucasia. So this is the demand for healthcare services, and this is the supply of those healthcare services. Now, for simplicity, assume doctors spend 1 hour with the average patient. This allows the hours that a doctor supplies, H, that's going to be the quantity of healthcare supply, Q. Also assume that 0% of private practice income goes to paying expenses because Western Caucasian doctors all practice medicine in their home offices. And they use an AI for billing, taxing, filing, patient management, and all of their office functions. So they don't need anybody else except themselves. What's going on here is they're spreading that AI cost out across all the hours they supply in the healthcare market. And so you can think of the annual subscription price for this AI service being pushed down to nearly zero in a given hour. Now, these assumptions allow us to transform the above equations into the demand and supply for physician labor by simply replacing the price of an hour of healthcare services, P, with the physician's hourly wage, W, and replacing hours of healthcare services provided, Q, with hours of labor provided by the physicians, H. So these two equations are identical. Now, these assumptions are overly simplistic, but you get this idea that there's this one-to-one relationship between the hours of physician supplies to consumers who are demanding their labor, right? So labor supply of physicians ends up being medical care supply. And the demanders of that medical care are the patients demanding that hour of treatment from the physician. So this is a consumer, right? Consumer demand. And this is the labor that is demanded of physicians. Again, the consumer of these services. This is the supply of that healthcare. And who's supplying that healthcare? A physician. Okay, so what we're going to do is we're going to copy this equation into Desmos. We're going to copy this one into Desmos as well. And then notice that the W-axis, this is also the P-axis, right? The W-axis goes from 250 to 0, and the H comma Q axis goes from 0 to 500. So what we need to do here is we need to modify this. So I'm going to go to graph settings, and I want Y to peak out around 250 and want X to peak out around 500. And then I'm going to change the colors to black for the two lines. And then I can squeeze this so you can see the supply and demand of healthcare services. You can see the labor demand and the labor supply of physicians' effort, right? So the first number is the X value, and the X value here is H. So that's 246,000 physicians supplying their labor. Again, this is per hour, right? H is in thousands. You have 246,000 physicians, each supplying their labor during a given 1 hour period in the day. And they're doing that at a rate of $149 per hour. Okay, now when I do that, it automatically draws these dashed lines to the equilibrium. Now, another way to think about this, because H is Q, copy this down here. I'm going to change this to P, change that to P, change that to Q. I'm going to change these to purple equations. So if I drag this down here and I drag this down here, you can see that the black lines are the purple lines, right? This is the demand and supply of healthcare services. And this is the demand and supply of physicians' labor effort. We can think of this first value as H in equilibrium, or we can think of this value as Q in equilibrium. So 246,000 patients are treated by doctors, and they pay $149 per hour. And we're assuming the labor market is perfectly competitive, and we're assuming the healthcare services market is perfectly competitive. Now, the president of the KMA, the Caucasian Medical Association, learned much about monopoly pricing in her Principles of Microeconomics course. If the monopolist can estimate the demand for labor, physician labor, or patient demand for healthcare services, they're one and the same here, given our assumptions, it can restrict the quantity of labor supplied by physicians, or it can restrict the quantity of healthcare services supplied to drive up the salary of physicians or drive the price of healthcare services up. Since KMA president knows the above labor demand equation, again, she paid economist and data scientist to estimate it. Multiplying the right-hand side of its equation, right? Multiplying its right-hand side of its equation, which we put in blue here, by hours of healthcare services provided. So we're going to replace W here with what W equals in the labor demand equation, right? That's what we do here. We have W, and we replace it with what it equals on the labor demand equation. And the result is a factored equation for what's called the parabola. When we distribute the H here and here, we get a quadratic equation. If we leave it factored, we have two zeros. This total cost of this union is equal to 0 when H is equal to 0, or when this equals 0, right? So it's a parabola that has two zeros, one at the origin, and then it went out at some number that you can compute by dividing 198.2 by 0.2 to get that x-intercept. And then the parabola goes up and then down because the quadratic part has a negative coefficient. So it'll rise from the origin, peak, and then fall. Okay. Now, to get the monopoly's marginal cost equation, she remembers that the above equation needs to be differentiated with respect to H, right? So you need calculus for that. However, she also remembers her economics professor saying the result of doing that yields an equation with the same intercept as that of labor demand and a slope that is twice that of labor demand. So if you remember, here's the labor demand equation, right? So it's going to have the same intercept, but it's going to be twice as steep. And we can see that right here, right? So it's going to have the same intercept, but it's going to be twice as steep. So we're going to multiply that by 2. And 2 times 0.2 is 0.4. And when I draw that, when I hit enter, look what happens. MyOpenMath draws the marginal revenue curve, or the marginal cost of the union, I should say, the marginal cost of the union. Because the demand for physician labor is patient demand for healthcare services under the above simplistic assumptions, she knows that the marginal cost equation in the monopolized healthcare services is the above equation, but with H replaced by Q. So what that says is we just got to, type the 198.2 here and the 0.4. So the marginal cost equation, the marginal cost curve in the monopolized healthcare services market is the marginal cost of the union in the labor market for physicians. Okay, so they're one and the same. They're both a red line. So what I need to do now is I need to type, and what I'm doing is going to type little m for marginal cost equal to 198.2 minus 0.4 H. And I'm going to change that to red. Limiting the number of physicians who can legally practice medicine in Caucasia by issuing just blank thous medical licenses. So what the union does, it, instead of issuing 246 medical licenses, or instead of just allowing 246 people to practice medicine without a license in Caucasia, what happens is the union will reduce the number of licenses to 184.5. And remember, this is in thousands, right? Limiting the number of physicians who can legally practice medicine in Caucasia by issuing this 184.5 thousand medical license allows the KMA to raise the salaries of its members to what? The fees. We're talking about the fees, right? In line 6, I'm going to type X equal to 184.5. Then I'm going to click on this to edit that line, the width down to 1. Okay, so notice that this vertical line here is a dashed line, and it passes through this point here. Now, if 184.5 licenses are issued, only 184.5 thousand people can practice medicine in Caucasia. Now, the lowest fee they'd be willing to accept per hour is $124.4, right? But that's what they're willing at minimum to accept, right? The thing about a monopoly is it can charge up to the demand curve. So by limiting the number of people who can legally practice medicine in Caucasia, they can push this fee that doctors charge up to $161.3, because that's the most consumers, patients will pay for this level of service, 161.3. Now, when I put that in, you can see that here's the 184.5 licenses. So instead of, letting whoever want to practice medicine, 246, this union, known as the Caucasian Medical Association, can restrict membership by using licensing, a power it gets from the state, the government, and then it can charge up to the demand curve. H and Q are the same thing, right? Hours supplied by doctors is the same as quantity of hours supplied to patients, right? So this is 184.5. That's how many is supplied to treat patients. The price of those services can be increased to $161.3 per hour. Now, suppose ethnic minorities were predominantly raised in low-income households and attended underfunded, lower performing public elementary, middle, and high schools. As a result, their paths to graduating from medical school likely involved attending lower ranked institutions and accumulating significant debt. Consequently, their reservation wages would generally be higher compared to students from wealthy or upper middle class backgrounds who attended high performing schools. The Caucasian Medical Association would likely reject physicians from ethnic minority backgrounds. If the KMA lacks the authority to issue medical licenses, physicians from ethnic minority backgrounds would not be barred from practicing medicine in Caucasia. This increased competition will result in the competitive outcome, right? In the competitive outcome, 246, again, this is in thousands, 246,000 doctors would practice. But that would pull down what? It would pull down the fees they can charge for that hour of service, right? To $149 per hour. So not issuing licenses or issuing 246 licenses would expand healthcare access. And it would diminish the discrimination that goes on, that has been associated with licensing, as it is the case in the United States with the American Medical Association. The American Medical Association apologized, if you remember reading this, it apologized to people of color, women, and Jewish people for its licensing practices that resulted in the closure of all but 2 Black medical schools, and the fact that a very small, tiny percentage of doctors were women, people of color, and Jewish people. If the KMA persuades elected officials in Caucasia that non-KMA members are inadequately trained and unsafe, arguing that only way to protect patients is by granting KMA exclusive licensing authority, they can reduce competition by refusing to license the blank 1,000 physicians from ethnic minority backgrounds. The difference between this 246 and this 184.5, the difference in those two are the number of ethnic minorities who want to practice medicine but are eliminated from practicing medicine through the KMA's licensing effort. So we have to subtract 246, the equilibrium quantity of doctors practicing each hour in a competitive market, from the 184.5 that results from the licensing effort that is used to, 1, discriminate against the ethnic minorities, and 2, to drive the wage up this labor demand curve, which also works as the service demand curve for healthcare. So we're going to subtract 246 and 184.5. And we get 61.5. So we're reducing the quantity of doctors by 61.5 thousand physicians, and they are from ethnic minority backgrounds in Caucasia. This would push the price of healthcare up to 161.3, right? Which is also the doctor's hourly pay, and because it's a fee, right? All right, I'm going to let you click that link to answer this question.